So have you already given up on your resolution to lose some weight just a few weeks into this new year? Well, our next guest says with his help, you can drop those unwanted pounds and you can control your weight once and for all.
Dr. Sunil Sharma is the founder of New Life Bariatric Associates. And Dr. Sharma, thank you for being here. You are not only the founder of this practice, you are also a bariatric surgeon. So let's get into your story a little bit and talk about what made you want to get into this field and become a bariatric surgeon.
I've been a surgeon for more than 25 years, and I had extensive training in the United States, which involved general surgery training. I'm fellowship trained in thoracic surgery, transplant surgery, and bariatric surgery. So during this, my long journey, what I realized and discovered that bariatric surgery is perhaps the greatest innovation in the history of surgery for the last 250 years. Here is the surgery which can cure your many medical problems. Diabetes, hypertension, high cholesterol, they all disappear. The diabetes disappears in 48 to 72 hours.
Wow.
So there has never been an operation which can cure these uncurable. Still now.
Cure diabetes, and we're going to go into that more next week because I think what people realize that bariatric surgery can be a cure for diabetes. I mean, their eyes pop open, and that's just, one of the great things that you're able to do with your profession.
Yeah, but as you're talking about that, I'm thinking about the misconceptions that sort of exist too about bariatric surgery, and that it's a cosmetic surgery, and yet it has all these great benefits. So tell us, is it a cosmetic surgery?
Yeah, that's a misconception. Bariatric surgery is not a cosmetic surgery. Obesity does not come alone. It brings with it a lot of evil friends. Diabetes, hypertension, high cholesterol, sleep apnea, fatty liver, the list goes on and on. In my mind, every single disease known to man is directly or indirectly linked to obesity. The strength of the operation for bariatric surgery is curing these life-threatening medical conditions. If you have diabetes, hypertension, high cholesterol, what it's doing is clogging your arteries supplying to your heart, to your brain, to your kidney, subjecting you to the risk for multiple complications, stroke, renal failure, heart attack, all those things. And amazingly, bariatric surgery cures in high 90% most of these life-threatening medical conditions. Weight loss is just a bonus.
Sure.
Yeah. The reason we do bariatric surgery is to make you more healthy.
Yeah, which is so important. I mean, it's just amazing that weight can contribute to so many adverse health effects, and some very serious and life-threatening. Talk about how bariatric surgery has evolved over the past 10 years. I mean, you're very well versed in the field. What have you seen with the advancements in bariatric surgery?
Yeah, bariatric surgery is not new. For example, gastric bypass was started in 1960s. But the technique has changed over the period of time as we got more understanding. But really what has changed in last 10, 12 years is the approach by which we do the surgery. Traditionally, the surgery was done by making a big, large incision and has a lot of complications, very painful. The patient would stay in the hospital for 10 days, a lot of heart, lungs, and other complications. Around about 2000, we changed to laparoscopic surgery, where we make 4 or 5 small cuts, put the instruments and the camera, look at the monitor, do everything, and in 48 hours, these incisions healed. And recently, we have started doing the whole operation gastric bypass by a small cut in the belly button, where we perform the whole operation. The patient can go even same day.
Wow,
home.
same day.
So really the approach has changed. It has gone from most invasive to minimal invasive to now we are doing least invasive. Even complex operation like gastric bypass, I've been able to do close to 150 just by a single cut.
Yeah.
So making it almost like a scarless and painless surgery. So things have really evolved and it has become more acceptable.
Yeah, so with all that said, I mean, I have to imagine that the folks who are thinking that this surgery may be right for them are probably a little bit apprehensive about what does recovery look like, what are the lifestyle changes that I'm going to make, and I know that, doctors like you say that it's not just you come in for the surgery, there's maintenance that's required after this is done. Talk more about that and what folks can expect from the procedure.
Yeah, it's just not technically doing the surgery. That's the difference. There are many surgeons who will practice bariatric surgery as a practice. And studies have shown, or experience tells us, that you need to have a program, a bariatric program, because education is the fundamental for long-term success. So anyone who comes in, we do 3 to 6 months of lot of education. We do behavioral intervention, eating right, exercise, and all other things. And there is a maintenance program after the surgery to make sure you do. Bariatric surgery is just a tool, a very powerful tool given in your hands. And if you're educated how to use that tool properly, the goal is to have lifelong benefits with the surgery.
Yeah, life-changing, life-saving.
Right.
Life-saving, life-changing. Right. It's a new life to it.
It really is. Dr. Sharma, I'm sorry to interrupt you. Go ahead. We have about 15 seconds left.
Not only your outside changes, but your inner changes too. And that's what we provide the new life to these patients.
All right. Well, thank you for providing that and coming on for your expertise and perspective. And thank you so much to New Life Bariatric Associates for sponsoring this segment. And for more information, you can visit their website, which is www.newlifejax.com. And to schedule an appointment or to get a complimentary weight loss evaluation, you can call the number there on your screen, 904-399-4004. And next week, Dr. Sharma will be discussing curing diabetes with weight loss surgery. So we look forward to having him come back next week.